think we'll call the meeting to order. It looks like it's 4 o'clock. Now, someone tells me that none of these clocks work right, so I better check here. Yeah, it's close enough. It's pretty close. Okay, we'll call the meeting to order. All right. Certify the meeting, all requirements have been met.
Yes.
Okay. We have an 11-item agenda. Is there a motion to approve?
Move to approve.
Okay, we got a motion and a second. You have a copy of the minutes from the November 4th meeting. If you've had a chance to look through it, any additions or subtractions, or, that isn't the right term, additions or subtractions? Corrections, good grief. I've been breathing too much sawdust, I think, at home. If there are none, is there, okay, Jeannie, okay, Bridget? All those in favor, say aye.
Aye.
Aye? Opposed? Okay. Moving on here, we have discussion and approval for the plan, ADRC for 2025, 8521 plan.
Okay. Good afternoon. So today I am seeking approval for our county's 8521 Specialized Transportation Assistance Program application, which is administered by the Department of Transportation, Specialized Transit. So just a little bit of background about the 8521 program. It was established in 1978, so it's been around for quite some time. And it aims to promote the health and welfare of disabled and elderly adults by increasing their access to affordable transportation. So the total appropriation for the program is nearly $16 million in 2025, with Trempealeau County receiving the minimum county allocation of $79,889. So the state or the DOT tells us exactly what our allocation is. And so a local match of 20% is required, which is amounting to $15,978. For many years, our county has used our allocated funds to operate two different programs. Those programs are our local bus service and our local van service. We do believe these two programs are operating well and serving our target population effectively by providing access to affordable transportation options. So we really are not making any fundamental changes with our allocation or our services. All requirements of the program have been met, including scheduling a public hearing, which was held back on November 18th. Copies with descriptions of the project were mailed to all of you, and approval from the board is needed to submit this formal application to the DOT. So I guess I'd just like to open it up to whether there are any questions regarding the 8521 or regarding our plan.
When you talk about disability, would that be an actual official designation of having a disability? Or can someone call and say, I'm currently disabled, I had knee surgery, and then they can partake?
We have looked at it as a very loose definition in our county. Somebody just has to declare a disability, and we would honor or respect that. Also, it's pretty clear in the language that, so for example, if we were going to, on one of our bus trips to La Crosse, for example, and there were openings, somebody that was under 60 that did not have a disability could ride along. So the target really is over 60 or disabled individuals, but if there are openings, we would serve them as well, which is consistent with what the 8521 is intended.
Would you describe the bus service and how that differentiates from the local van service? please?
Sure. So the bus service, we operate one bus in our, there's one bus in our fleet right now. And so it truly is just that one bus, that one vehicle, that is considered the bus. Now, the bus, we do operate in our county and out of our county, so we're using that bus typically when we are going on those trips to Eau Claire or La Crosse. Sometimes we go to Black River Falls, and when we do those fun day travel trips, for example, we're doing some Christmas light outings this month as well. So that is all considered in that bus. And then the local would be when we're using our van service, or our van service is that. It's our vans that we're taking in our county and doing the transportation in our county.
And how might those destinations vary from one service to the other? Or is there any variance?
It's typically that bus is being used out of our county.
Okay.
There's very few times that it's being operated in our county, because most of the time in our county, it's smaller amounts. We don't have 8 or 9 people for the most part going in any one trip, if that makes sense. We could do it if we had requests to do in-county transportation and we had a larger group, but typically it's one individual that's requesting to go to, for example, a medical appointment, and so it's just we're using those vans versus the bus. If that makes sense, if I'm answering.
So obviously, some may be shopping trips, some may be going.
Yeah,
to-
I would
to
say
the-
for this 8521, there are a lot of reporting requirements. So we have to track every single trip that we're doing. We have to track what the purpose is. I would say the most popular of the in-county trips, the most common would be medical appointments. Second would be shopping. Third would be banking. Pharmacy would be up there, but that's pretty much. And then you do have some social outings. We have people that do take the bus that'll want to meet a friend, for example, at a restaurant, or some that are going to senior dining. But it's very, very often it's the medical appointments, and then it's the grocery shopping.
So if somebody calls you up and needs medical down in La Crosse, it would cost them, and you take them by van, it'd be $3?
It would be $8 right now.
$8.
$8, right.
$8 total.
We don't do a lot of that as far as to La Crosse for medical appointments, because it just gets very, very, on that bus, very challenging, because it's hard to meet the needs of, the people that are going for medical appointments. They have a certain time they need to be there, and it varies so often, as we all know. You go to the doctor and sometimes you're running late, and then you've got people at Walmart or at Hy-Vee that are ready to be picked up, and then there's a delay with your appointment, and then then they want you to do blood work. So we don't typically do a lot of those medical appointments when we're going to La Crosse or Eau Claire. So we're meeting with those individuals and discussing other resources for them to get to those appointments outside of our county. Yeah.
Anyone else? Now, you're looking for an approval, I assume?
Yeah, yes, it does require
Okay.
approval.
I just have one more question. Do you remember roughly what the amounts were last year for the funding?
I think it was identical,
Oh, was it? Okay.
yeah. Yeah, I think it was identical to last year, and I think it has not changed for our county for quite some time. I could look that up if you'd like to. Yes, they do. So when when you're meeting with,
Call the state legislature and let them know. It's
yeah.
very rarely that increases.
Yeah, because there really is not opportunity to increase what we're doing with the current levels, so,
Let's just hope it doesn't decrease.
right, right.
That's what
Yeah.
worries me.
I would think that it would eventually increase with all the increase in the elderly,
Yes, yes,
so.
you would think so.
That's logical thinking.
Okay, Rich?
Who are the drivers then? Who do you have for driving? Are they full-time people that?
They're all
are signed-
part-time
all part-time?
individuals.
Volunteers or part-time paid?
All paid individuals, yep. So one thing to know is that for our county vehicles, we require employees to be driving them. So it's not that we have volunteers that are able to drive, like, for example, our bus. That couldn't happen. So yes, all of the drivers for these two programs are all paid part-time staff. I believe we have 7 current part-time drivers. Most of those drivers are doing home-delivered meals, but there are a few of them that do both home-delivered meal deliveries and transportation. Dean Service, if any of you know him, he's driven for us for several years, but he's identified as our lead driver. So he too is part-time though, not full-time.
I see. Good, thanks. So anybody over 60 that needs transportation can contact your office? That's what you're charging?
Yes, and if we look at number 7, I do want to talk about, number 7 on our agenda, talk about a modest fee increase for 2025, but yes, so,
I see.
yeah.
That's good.
And it is door-to-door service, so we are picking individuals up at their homes and dropping them off at their homes throughout the entire county. There are no areas that we would not serve.
Now, from this total budget, obviously, it's supporting the vehicles, fuel, maintenance, and as well as the
As the
drivers.
drivers.
And I suppose it also, some of the expenses within the office too. For
Yes.
administration and coordinating.
Correct. Yeah. And Sammy Becker is our transportation coordinator, and then Becky Rick, who's an administrative staff. Between the two of them, they do most of the scheduling. So if you call and want to use the services, typically you would talk to one of those two individuals to schedule your ride. So yes, it would be the drivers and then those two staff, part of their salary is paid for through this.
Do you know how many transports you did this year? Roughly?
I will know. I do not have, right, we'll definitely, we will be, compiling all of that data at the end of the year. But the reporting requirements are, we have to report every quarter to the DOT and then annually. So I'm sorry, it's a lot. It's a lot of trips, but I don't even want to take a guess right now because I'm afraid I could be really off.
More than the year before?
I was gonna say, I think we have it in the annual report.
Yeah,
though,
it's in
right,
the
from
annual
last year.
report, so we definitely compare from year to year. And of course,
so we can-
COVID, it went way down. We
Right.
we weren't really transporting, or not very often. But yeah, we can compare it year to year, and I really have not taken the time to compare this year compared to last year yet, but yeah, you'll see that.
Yeah, we do that analysis once that comes up, but it would be an interesting number to bring back from the last annual report, yeah.
Are there options for medical appointments out of the county that you can offer them or offer people, and what is that cost of that?
It just really, really varies. So we have a whole list of transportation options that are available to individuals. So our resource specialists do meet with people and review all of those options. It's a tough thing in this region, especially that kind of transportation or transportation as a whole. It is encouraging because Western Dairyland did just start a new program that utilizes volunteer drivers and will take people to La Crosse and to Eau Claire. So I'm waiting on a brochure of that and hope to include that in our next newsletter, for example. But we do I just have an informal number that I can give to people, but until, they really haven't started even advertising that yet. But besides that, the most common transportation companies would be like the Handy Vans, the Abbey Vans, Pine Creek Transport. And so those resource specialists are really meeting with individuals, giving them that information, but also trying to help them utilize informal support. So talking about family members, neighbors, church groups that, just other individuals that maybe people have not thought about of trying to utilize. So
Yeah, because like Pine Creek and Abbey, they're.
it's expensive.
Costly.
Right, yep. The other thing just to remember is a lot of individuals that we work with do have MA. And so when individuals have MA, they are able to use the state transportation. And so not everybody knows that or understands that, and we're working, we often remind people of that and give them that resource as well, so.
Okay, nothing else? Do I hear a motion to approve the?
I'd make a motion to approve.
Okay. Okay, Ron, we'll give Ron that one. Okay.
And there's nothing to sign for that, or I just need to show them the minutes of the approval, so.
Okay, any further discussion then? Okay, all those in favor of the motion signify by saying aye.
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 Opposed? Carried. Okay, I think we must have some vacancies in the ADRC council.
We do, yes,
Okay.
we do. Okay, so the advisory council for the ADRC, they do just that. They advise the ADRC and they advise this board. It is their responsibility to ensure that all older individuals and individuals with disabilities, regardless of their income, have access to services and opportunities in the county. The council does meet bi-monthly, and there are 12 members of the council. We currently are down 3 members. Out of those 12 members, there is representation from those over 60, those with developmental and physical disabilities, as well as a human services board member and a county board member. This board oversees the council. However, members must be approved by this board, and then they get to be appointed by the county board chair and approved by the full board. So out of those 3 openings, we have identified 2 members. So those 2 members are in the agenda, but what I can tell you is Phyllis Olson is a individual from Blair, and Joan Sasala is an individual from Independence. Both of those individuals have shown interest in the ADRC programs, and today we are seeking approval of those 2 candidates. So wanting to just ask, do you have any questions regarding the advisory council itself or regarding either candidate?
Anybody? Phyllis is my neighbor behind us.
Okay.
So she's
So you know her.
she's over 60.
Yeah.
And she-
Phyllis is somebody that does often attend senior dining in Blair. And Alan Robertson had been he had been a representative and is no longer able to serve. And so it seemed, it seemed nice to, or it seemed appropriate to have an individual from Blair taking over his representation.
Questions about
And
it?
Joan Sasala would be, in essence, taking over for Dora Jean Blaha, who also is no longer able to fulfill her role in the board. Joan and Dora are actually friends, and so Dora, it's interesting because I had talked to Joan, but Dora had also talked to Joan, so we both had her in mind. I do want to say, when we're looking at a third candidate to come onto the board, it would be really nice to identify somebody from that Galesville or Trempealeau area, because we currently would not have any representation from that area, so.
What do you need, what would that person be? What would they need
Oh, as far as the criteria.
as the criteria, yeah?
Over 60. Yep,
Okay.
over 60.
All right.
Is there anybody over 60 down then in your area?
I can think of a few people, but Melissa knows the person that I recommended the last time, and I was unaware of her disabilities, so that didn't necessarily go over well, but I'll
Yeah, if
put
you
the
would
word
like
out
to,
and
okay,
we'll see.
that would be good.
Yeah, I have some ideas about Galesville, so.
Yeah, we have a
You
lot
might
of
have some ideas from
retirees
Galesville,
in
or-
Trempealeau.
Yeah, okay.
All right.
For those two, I do.
I'll second. Oh, go ahead. It's all yours.
Okay, Ron and Rich. Okay. If there's no further discussion, all those in support of these candidates indicate by saying aye.
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 Those opposed? Okay, that's carried then. Now you get to number 7.
I feel like I'm doing a lot of talking here, but this is the last thing I'm
Talk away.
Okay, so we did feel it was appropriate to talk about possible increases for 2025. I think, Rich, you kind of just commented, that seems pretty reasonable of what we were charging in 2024. The last time that we did increase the fees were back in September 2023. And so, yes, it increased from 4 to 8 for the bus and from 150 to 3 for the local van. My recollection at that time even was kind of like, I think this entity kind of had said that this still seems pretty low, but we wanted to do more of a modest hike at that time. But being that it has been, over a year now, and operational costs are not decreasing, we felt it was time to revisit this. Additionally, we are getting feedback, and I can see this myself, is using $5 bills instead of $1 bills would certainly greatly improve the efficiency of the cash handling process. So these fees, they're right in line. They're comparable to other counties. I still feel that it's budget friendly. This is door-to-door fees, so what my proposal would be, our proposal is from $8 to $10 for the bus service, and then from 3 to 5 for the local van service. So, are there any questions or comments regarding this recommendation?
I think I'm gonna sell my cars and just call you folks. Very reasonable transportation.
But you gotta be over
Very good.
60. You gotta be over 60.
Well, I think I just made it
Okay.
a few years ago. No, I think that's great. I think it's definitely,
It's very reasonable. Yeah.
I think so too.
I said you're right, it's very reasonable.
yeah.
I'll make a motion to approve the ADRC transportation fees for 2025, the bus service from $8 up to $10, and the local van service from $3 to $5.
Okay, do I hear a second?
I'll second.
Okay, there's a second. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed? Opposed? Motion carries.
Okay, thank you. Happy holidays. I'm done.
I just want to say your little area looks so inviting
Oh, thank
down
you.
there. I need to stroll through your offices, but it looks really nice.
Thank you. Thank you. I think just the increased traffic, people are seeing the resources.
Right,
That's what
right.
we're seeing, so, yeah. I think
Well
it's-
done.
Yeah, we're happy. We're really happy in our new space. Good, so, yeah, it's working out well, and thanks to Julie, because her staff they're the ones that really had to shuffle and is there create space.
You don't have any issues with accessibility, right? With wheelchairs or anything?
It's going as well as it can be, and I will say the security staff has been just great.
Okay.
They're helping get people where they need to be, and no, I don't think we're having.
Okay, good.
and
That was the only thing I was worried about.
It's just a little bit of a hike, but everybody's working together, and.
Okay.
And we're not getting complaints or concerns,
Okay.
so.
All right,
I
good.
think we've just had one person that he actually declined assistance from security. Security wanted to get him assistance to get down to our area, and he declined, and he had some issues, but.
Do you want to describe for us your temporary housing? I assume this is temporary. You're going to kick them out eventually, aren't you? You want to just describe where you're at and,
So yeah, in the area that was family and children's, they've completely then relocated to the old sheriff's area. And so all of our staff is now occupying that space. So when you're walking past the land management, that first, and past that soda machine, that's the Coke machine to the left, that first door is where all of our offices are. All of the ADRC staff have their own offices, which is really nice because we can all meet with individuals in private. And then we do also have one office that is just dedicated to transportation staff and our part-time staff, so they can come in and bring in their money they need to count and get their assignments and their route sheets, et cetera. So it's working out really, really well.
so that's really not very far from where you will be permanently
It
located.
isn't that far. No. We couldn't be any closer within our unit right now or in our department right now. And it's not that much further than we will be. But as you can see when you walk through, there are walkers, or there is at least one walker all the time there, and a wheelchair. And like I said, I've seen it myself. It happens often that security, they're offering to help people get where they need to be. They're called down to our administration to say, yeah, we've got somebody here. Is there somebody that can come and help them get down to our area? It's working well. And there are the couches in the areas where people, if they wanted to take a break, they can sit down and wait and. Yeah, no, I think we're very, very happy. It's just good to have the support of our entire department right here together. I think it's just.
There's so much accessible parking right in the front of the building, so that's very helpful.
Yes, and you saw the parking that, there are, I think they only have the one spot up yet, but it's dedicated for ADRC
good, okay.
customers or veteran customers. Yes, so there are two, I think they just have not gotten the second parking spot up yet, but.
Okay.
And I
think
will
that's
have to
good.
give kudos to both Melissa and Julie for, it wasn't me saying, hey, we should do this. It was them saying, hey, this makes sense, let's do this. And I'm like, you sure? And they both said, yeah. So, I appreciate both of them. They're awesome teammates.
Again, I'm just thrilled to be back in this building. It really is. The additional support that we have here is just very, very helpful. You don't realize what you're missing sometimes until you are like here and gosh, like all these perks that we have being in this building.
Yeah, the soda machine is right out your door.
Yes, and caffeine is my friend. So yes, yeah, that is one of the perks.
Good, thank
Yeah.
you.
Yes, yeah. Thank you for asking.
Moving on to number 8, CPS report process overview.
Yeah, I thought I would ask Julie to just kind of give, this isn't the frontline staff necessarily given this, but I thought we wanted like kind of the overview and offer folks opportunity for questions and things like that throughout this process. And Jeannie probably has a pretty good idea of the entire process too, but sometimes there are changes, so, and Julie's a great resource, so take it away, Julie.
Thank you. So for those of you who don't know me, I think I've met all of you, but my name is Julie White, and I am the Family and Children's Unit CPS Supervisor. I was asked to do a little overview of our reporting process and kind of outcomes and what that might look like. So they'll stop me if you have a question as I'm going through this. I'm going to try to be brief, but also thorough. So there's a lot of jargon and terminology that goes along with the CPS world, and so the first thing that I always say is that we take a report on our access line. We call it an access line. Many other places call it intake, but we call it access. I don't know where that comes from. I think it's just been out there forever, but the federal government requires that we have 24/7 access to a child abuse and reporting hotline in order to then recoup some of the federal funds that come our way. So we do have a person 8 to 4:30 every day in the office that takes calls on that line, and then we have an on-call worker for evenings and weekends as well, and holidays. All of our examination of our child abuse reports are done obviously through the lens of safety, and the state has really prescribed some very specific safety definitions for us to guide our decision-making when we are going to either screen in a report or screen out a report. I just learned today that the terminology of screen in and screen out is also not common to some people. They don't understand what that means. So when we screen in a report, that means that it meets some criteria that the state has told us it has defined for us, and then we do an investigation. We call those initial assessments. If we screen it out, that means that there's not enough there at this time, and so we screen it out. It gets recorded and documented in our system, but we really don't do anything with it. So we have different thresholds for intervention when we have a CPS report. We have what we call present danger threats and impending danger threats. So a present danger threat is defined as an immediate, significant, and clearly observable condition that is occurring or in process of occurring at the point of the contact with the family, and that will likely result in severe harm to a child. So present danger has to be occurring at the time that the call is made. We have 23 identified present danger threats that are described and defined by the state. They are when we get a report and we're examining it for present danger, we're looking at 4 areas. We're looking at the type of maltreatment that's being alleged, the condition of the child, whether they're disabled or do they have an injury, how is the child acting, the characteristics of the parent or caregiver, and the characteristics of the family as a whole. So we look at those 4 areas, 23 different things we can identify as a present danger. If we identify that, we are required to respond to that situation same day. So we have to send someone immediately to go and do their work to ensure safety. The second one is impending danger. Impending danger definition is a foreseeable state of danger in which family behaviors, values, motives, emotions, or other situations pose a threat that may not be currently active but can be anticipated to have severe effects on a child anytime in the future and would require a safety intervention. So something that's we know is likely to happen in the future. It must be specific and it must be observable. There are 11 identified impending danger threats that we can respond to. When we identify an impending danger, we have to respond within 24 to 48 hours. Then all other child abuse reports or neglect reports that don't fit those 2 criteria, but we still feel like, oof, we should really do something with this, we can respond within 5 days. So we either have a same day, 24 to 48 hours, or 5 day. There's another category of another category of safety threats that we don't utilize in our daily reports because we don't get many of them, but they are placement danger threats. So when we have a child in placement, there's a whole category of additional safety threats that are identified by the state and defined, and there are 17 of those possible safety threats. So when, there are certain criteria that the state requires us to request an independent assessment. So we get a call and we have a situation that we know we need to do something with. Certain situations require us to ask another county to conduct that assessment for us. We cannot do it on our own. There's 4 of them. So the first one is if the child is placed in a foster home that we have licensed, we have to reach out to another county. We have to ask them to screen the report. We have to ask them to do the assessment. The second one is if we have a child placed in a home that's licensed by another agency or another county. We get a call. We have to also ask another county to screen that report and do the assessment. If the child is in the household of an employee or an agent of our agency, we have to ask another county to screen that and take the assessment if they screen it in. And then if there is a substantial probability of bias, we have to ask another county to do an independent assessment for us. So a substantial probability of bias is clearly defined also by the state. The state does a very nice job of giving us strict guidelines to follow. Substantial probability of bias can come up in a couple of different ways. If the occupation of the alleged maltreater is such that it necessitates an ongoing working relationship with us, that's considered substantial. We could have a bias in that report, so we would then request another county to do the screening decision and the assessment. A substantial probability of bias may also come into play if the subject of the report is an immediate family member of an employee or volunteer of our agency. So that's another situation where we can't really touch it. We have to ask another county to do it. If there is a well-known community member who has a report come in about them that is likely to generate media coverage, we are not required to necessarily request an independent assessment by another county because it says an access report involving an official whose office entails a relationship with us. So for example, one of you in this room or the county board chair or something like that, those should be referred outside the county. But the mere fact that a alleged maltreater is a public official does not necessarily mean that we need to have an independent assessment. So it's kind of contradictory. Just because someone is in a position of a well-known position of power in the community doesn't necessarily mean that we need to do or request an independent assessment unless that person has a well-known established relationship with us, is what they're saying. So those are the ways that we get reports. Those are the ways we, very briefly, the ways that we kind of look over the safety threats that are identified and what we are required to do in each situation. After that, it goes to initial assessment, and then our IA workers take it, and they have 60 days to assess the family, assess the situation, make a determination. Everything that we do in this field is always through the lens of safety. We're always, even our ongoing workers, when we've had a case open, is this child still safe? Is this child safe? How can we make this child safe? I think that's it. So
I was just gonna say, can you speak a little bit to when somebody makes a report, how do we respond to that person who's making the report? Because we obviously can't
Sure.
share some information with them.
So if someone makes a report, we have mandated reporters, obviously, and non-mandated reporters. A mandated reporter is entitled to a response from us within 60 days. If we screen something out, there's a form letter that gets sent to them that says what our response was. We either screened it out and took no further action, or we sent it to law enforcement, because sometimes there are reports that we can't touch from a child abuse perspective, but law enforcement can do something with it. So, or we can refer families to services in the community. So those are the 3 things that show up on that form letter. We send that letter to our mandated reporters within 60 days. If it's screened in, the IA worker sends that letter at the conclusion of the assessment. So if it's screened out, I send it right away. If it's screened in, they wait and get it at the end of the assessment. If there's a relative reporter or a random neighbor reporter, they aren't necessarily entitled to just automatically get that letter, but a relative reporter can request the letter, the outcome. So the only people who get told what we're doing are the mandated reporters.
And that's to a limited extent. I mean, we can't.
Yes, and it only says either we opened it for services or opened, like we did an assessment and now we've closed our case, or we've referred them to ongoing services, those kind of things. They don't get to know all the specifics. They only get to know what step we took.
Because I think sometimes people will, in the community will report something and, get a response of a very high level or just a not a very detailed one, which I think people are wanting, and in many cases we can't provide it. We've heard things like, oh, well, I've reported to Human Services and they don't do anything about it, Just because we would screen something out doesn't mean they don't have contact with our department in some other way, or that they're getting some other services from us. And when we screen things out, it's very clearly defined by the state and by statute, what action we need to, when we need to take action and when not, so.
One thing that comes up frequently that we deal with is we might get, let's say we get a report on something from a teacher at a school, and they report to us and we open that, we have an assessment open. We then, 2 days later, get another report on that same incident from another teacher in the school. They're not talking to each other or whatever. We screen that one out because we already have it open based on the first report. That teacher gets the letter that says, oh, we didn't do anything with this report. But they think, oh, you didn't do anything, and that's not exactly true. Also, we have gotten reports from like probation or DOC, and then they say, I reported this and you didn't do anything. Well, that's not necessarily true because we can't tell you what we're doing. We can't tell you that, so.
When you send that letter out that says that you closed it out, do you express the reason why?
No.
Well, not specifics other than it was reported earlier and we're acting on that?
I wish that we could, but it's a form letter and there's no changing the words. The system prints the letter for me, and I just check the box that says either, we.
That don't seem right.
I know, because I feel like, I wish we could say, like, no further action was taken because, and then put an explanation, but we can't. There's no,
Because
it
who says
doesn't.
that, the state?
The state creates that, yes, yes.
State's wrong again.
I think though,
Really?
I think that there's also, I can see where it could get out of hand because we have to be very, very, very careful about what we tell people when it comes to the families that we're getting reports on. And so they're probably trying to protect. They don't want some worker somewhere to say, we screen this out because da-da-da-da-da-da, and share information that shouldn't be shared. If we leave it open, for people to put words in there.
Should be another check mark there.
Well, sure, yeah, I don't disagree with that.
Category or something.
Another category that we
yeah.
can check, yeah. Yeah, because it is people do often think, I made a report and they didn't do anything.
I
No,
can see that, I've heard it,
yeah,
and there's probably reasons why.
yes,
Sure.
yep.
It's not necessarily everyone's business what's happening with a family.
No,
So,
no,
I mean, I
I'm not looking
feel
at that.
strongly about protecting the family's right to
Correct.
privacy.
Absolutely.
No, I'm not looking at that at all, Jeannie. I'm looking at, if a teacher reported, the teacher should know that, okay, they didn't totally dismiss it, they're working on it already.
Or something like we're following up on,
Following up.
just in.
It's too bad the teachers don't communicate with each other in this school.
Yeah, and that was
Maybe
just,
from
that was
another
just
school.
one example, but
Yeah.
that does happen where we screen something out because of that reason and then they think we're not doing anything. Or we might have an open case and they don't know, not necessarily an open investigation, but we might have an open ongoing long-term case and they might not know that. And so sometimes we'll screen something out and say, we can address this through the current open case. It doesn't need to be a whole new investigation. That letter prints and says we didn't do anything. But it's because we already have them open. So there's a lot of things that play into it, so. And 100%, we have to protect our privacy, 100%, so.
I was just curious, talked about other counties having to investigate. How far out do you go county-wise? And then is that just a courtesy
Yes.
fee back and forth? You don't get billed or, okay.
Yeah, it is as a courtesy. That happens a lot when we do courtesy work for other counties. Like if someone identifies a relative placement in our county and they put a child here, they'll ask us to do courtesy supervision of that child for that. We do the monthly visits and so forth. So we do a lot of collaborative work with other counties. I start usually with Jackson, La Crosse, or Eau Claire, because when you have those counties close by you, you start to develop relationships with other supervisors, and you might screen something for them, and then when you reach out to them, they screen something back for you. It's a very mutual relationship. So I start usually with those three. If I can't get anyone to respond to me or agree to do it, then I would maybe do Buffalo or Monroe, sometimes Vernon, Juneau. Like, I just go out as far as I need to go till I find someone that will help. But usually, Jackson and La Crosse are very receptive to me, so, and same, likewise, I try to help them whenever I can, so. And it is literally just either a phone call or an email. There's no special system thing we have to do. It's literally like, hey, I have a report I need you to screen, or I need an independent screen, and if you screen it in, can you also take the IA? You know, that's another piece, because they could screen it out, but if they screen it in, then, you know, they might say, I'll screen it for you, but I can't take the IA if I screen it in, some other county has to do that. So there's a lot of kind of mutual collaboration going on.
And the nice thing is that not everybody likes EWIS-ACWIS, but when you work with other counties, they have access to, you know, so you can look and see what they've done. So.
Yeah, not everybody likes, our system is called EWIS-ACWIS, that's the database where we keep the state CPS records, and not everyone likes it. It's not super user-friendly.
complicated,
It
yeah.
is, it's very complicated, but I did have a software developer person who was working on improvements to EWIS-ACWIS say to me, your state's program is one of the most robust in the country. So we're doing something right. But
It is, yeah, you can thank Connie, or what was her name, Connie Click?
yeah, somebody at the state level. So the state does a nice job of making sure EWIS-ACWIS has everything we need. It's just, there's a huge learning curve when you're kind of trying to navigate it, but.
And the state can access your EWIS-ACWIS to make sure your home visits are done and your documentation is done, and you get little notices
Yes.
when you haven't, we've experienced that here before when we had to, but yeah.
And I think the other thing too that I've learned from Julie and from Tricia too is that the state can also go in and audit who's been accessing these records, so that they know if you've been accessing a record appropriately or not, you know, and if not, that's a
You're in big trouble.
You are in
Yes.
very big trouble, yeah.
It happened in a case in Milwaukee where it was kind of a brutal case, and people wanted to see what, you know, and there were like 13 or 14 people that clicked into this child's record. And the only reason I knew about it is because it was a kid we had in special needs adoption. Nobody had any business knowing what was going on.
Yeah. Yeah, and that is a message I give to all my new staff. They have to sign an agreement to use the system, a confidentiality agreement and an understanding of how it works, and I tell them about that, and I tell them from the beginning, from day one, if you are caught looking at something you're not supposed to look at, that's very serious. So don't do it. So.
It's not worth it.
I just want to, I appreciate the opportunity to talk about this today, and I just want everyone to understand that this is the perception, or this is the perspective that I take. So a CPS worker is one of the very few entities that has the ability to take people's children from them, and we have to take that role very seriously. And therefore, the state, thank God, gives us very strict guidance on when we can do that, and when we should be doing that, and when we should not be doing that. So we have to have high levels of training in safety, and we have to be able to apply those decision-making skills to every work that we do every day. And it's a privilege for me to be able to do that kind of work for Trempealeau County, and we all take it very seriously, so.
We're lucky to have you, so thank you.
Yeah, thank you. Thank you, thank you. Any other questions?
That's not easy work.
No, but it can be very rewarding.
And screening out causes me nightmares.
Sometimes I do lose sleep over that.
I've got just a few questions before we move on. I assume the state gives you guidance in terms of when law enforcement is called in. Can you describe, just summarize that briefly?
Sure. So one of the biggest reports that we get that we are required to notify law enforcement within 12 hours is anything that has an allegation of sexual contact. Whether it's a sexual abuse allegation, so whether it's like adult to child or two children in the same home or anything that has to do at all with sexual contact, we have to send that to law enforcement within 12 hours. Beyond that, we have guidance as far as like the level of child abuse. Like if we are working on a case where we are seeing egregious abuse and we need to, we have, injuries or just something that is terrible and would likely be criminally charged, obviously then we have to contact law enforcement. We work very closely with our law enforcement agencies, so all through the county, and sometimes they'll call us and say, hey, I've got this going on with this family in this town, what do you think? And we'll work together to problem solve or whatever. So yeah, I hope that answers your question.
Well, I guess I'd follow up with that, with the comment that oftentimes when it's been my past experience years ago that when you have a family that's extremely disruptive in terms of its whatever, and it becomes necessary to remove a child, I would hope for the safety of the child and the worker that you utilize. I think I'm right in saying that ask the law enforcement to assist in that process. It can be a very dangerous situation for everybody concerned if there isn't some backup like that.
Correct. We do, and they are always more than willing to assist us when we need them, when we ask them to. We have used them a lot for those kinds of situations. We just this last week had a similar situation. We asked law enforcement to stand by. I will tell my staff, if you have a feeling that this is an unsafe situation, or you know this family and we know that this could get volatile, do not ever hesitate to ask law enforcement to help. And we never get a negative reaction, never. They're always like 100% will be there, so.
Yeah, I think even if it isn't essential, it's a good idea to have two workers out on that call.
Yep.
I know in the past, ahead of time, when you folks would go into a situation like that, you contact, at least they used to contact, back when I was sheriff, contact us, we would send out a detective to go with you guys, that way, because detectives want to be called out right away, not later on. And so they're on scene to begin with, initially with the first part of the investigation, because there's a lot more people to be talking to later on. So I know we always appreciated that and worked well with you guys putting a case together to be able to take the DA's office. So yeah, usually I know in the past they were always called us right away. We were on it right away.
A couple more questions. You mentioned you have people on call as well as, of course, regular office hours. Does the state have a central number that people are advised to call?
We do not. So some states do. Across the country, it varies state by state. I think Iowa and Illinois might have centralized reporting. Yeah.
Well,
Wisconsin-
Iowa doesn't have county offices anymore.
Yeah, so the state of Wisconsin, for whatever reason, back in the day, opted to have it be local,
Yeah,
which
yeah.
I appreciate that much better than a,
I hate to have
Yeah.
a abuse hotline.
yes,
Hopefully you'll get somebody.
Yeah.
I'm glad we're not.
I
Yes,
think
it's something
like
to that
that.
it
effect.
can be a little
Right.
bit melded.
Right, and that's for what we're a level 2 health department, and so that is, I think for a level 3, you have to have your masters and some other pieces to that as well, so, I don't know, I'm still, I can't remember that off the top of my head yet, but yes, I'm learning, so,
Okay,
yeah.
good.
We also one other vacancy, or I should say another vacancy we have is a program aide on Julie's team, and that's somebody who helps with like family supervised visits and could transport kids and that kind of thing. The last position that we have open, that just opened last Wednesday, is a family and children's services supervisor, so that's the for the CCS, CLTS, and Birth to Three programs, among other, and there are other smaller programs within there as well. So that just became open last Wednesday.
Did somebody leave?
That would be, that was Brenda Thompson. So she's no longer employed by the county. So. And then on the new hires front, we have a fiscal associate in accounts payable that was hired. We did actually end up hiring a part-time dementia care specialist, and she's started working already, which is relatively amazing, and.
I'm so glad that position was empty.
Yes,
for so long.
it was very, it worked for this person, for Tricia and, or Tricia Rodering, and, it seemed to fit well with
Oh, good.
everything, so, yeah,
That's good
so.
for the county.
It was a very good hire. We have also hired an ongoing social worker, caseworker, and, she started a few weeks ago. So we're having some movement on the hiring front. It's not, it goes in ebbs and flows, right, so. And then, so as far as some of those openings have obviously create some workload coverage issues, and so to try and figure those pieces out, we're bringing in some temp staff, and my thought was with that is to help with some of the more clerical functions. So a lot of our social workers or caseworkers have to enter scan documents in and save them as files in our system and that kind of thing. And it doesn't require the level of skill that we've hired those folks for. It's just kind of a normal clerical part of their role. So, so we're trying to separate those out, bring people in to do that kind of clerical work, to free them up to meet with families, develop plans, you know, and those kinds of things. So we're also trying to push our transition of the CCS program to LSS a little more quickly, or apply some pressure there. I know they're working as fast as they can, but we're trying to keep that moving along. So, so those are a few things. So any questions about the whole workload and you know, issues and vacancies and things like that? All right. To kind of piggyback on what Julie was talking about with the CPS reporting, we do think it's been a while since there's been any mandated reporter training, I guess, for our schools. And so we're looking at putting together some mandated reporter training for school staff, starting in the next few months. And it's just, schools have turnover just like everyone else, and even if you got that through school where, you know, you go through a social work program, for example, and you know that you're a mandated reporter, it's still helpful to know, well, where am I reporting it? And to have some refreshers too, like, like Julie talked about, if this person's reporting it, then should I be reporting it too, and those kinds of questions, you know, so.
Does your staff, somebody from your staff do the training?
Yes, yeah, Julie's got, apparently, I think Julie has done it in the past, or somebody in her unit has done it in the past, and so she's gonna take that, revise it, and then she's gonna be providing that for schools, so.
And then were you on the Western Dairyland meeting last? The Head Start people would be interested in having some mandatory reporting
Okay.
training.
That would be good too.
Yeah.
Just making a note here. Yeah, we just thought we'd start with schools, and we thought there would be some natural outgrowth of that to, you know, identify other stakeholders too who would want that training, so. The one other update on the work front, so we've been with the school social worker program, and we were down to one, and unfortunately now we're down to none because the Blair Taylor School District, Lynn Halverson got a hold of me and said they're going in another direction where they want to use more of that person's time on behalf of the school district, and I think they mentioned some behavioral health programming and things like that too. But they wanted to, we've met with them, and they wanted to make it a smooth transition for the county staff as well. So we're looking at, by the end of the year, having that, you know, the school district will be taking her back on full-time. So that's part of where we're looking at the workload coverage too, just making sure it's not a huge impact as far as coverage and cases, case assignments. But it was something that we needed to take into account and attend to, so. So that's kind of where we're at. And I think one of the things that we do have in place now, as we start talking with the schools again, if they'd like to, if there are any school districts who are interested in contracting with us in the future, we've got a lot of the structure in place, more so than what we did in the past, I think. Just expectations, because it's so much for one person to learn and know. And we wanted to pare that down a little bit so that it's a more manageable workload. I think that was a part of what makes it stressful too, because then you're wearing two hats, and you've got these 2 or 3 programs that you're looking at from the county, and then you've got the school hat on where you've got all of this work. And so I think part of what we've talked about with the schools as well is I think they started off, that funding piece helped them show the need for that position within their districts, which was helpful, and so now they're finding, hey, we really need this person to be here more frequently, so.
So it started out, there were like 4 social workers.
Right.
I know that Olivestrom does not have the position anymore at all, correct?
Correct.
But are there social workers still, like within Gale?
In GET has one, yes.
And Blair still has theirs.
Blair has theirs, and then, Osseo Fairchild has theirs as well.
Okay, so
Yes.
so there's still.
The social workers are still
There's still somebody
there.
embedded in the schools
Yes.
to, okay,
Yes.
all right, that's
Yep.
good to know. It's just that relationship with us is,
Well, and that's where we talked about too with those school districts, is just the communication, piece. And for those same programs that we're still gonna be delivering, for students in those districts, we're making sure that communication is happening and the regular school liaison meetings are happening, so that there's not a gap there. And we wanna have those conversations too, so.
okay, good.
The only other things I had were just related to more the health departments, just as some FYIs. We did have we had what's called the 140 review, and that's a review of the entire health department. And Bridget, you can chime in if I forget anything here, but, so that's where the state comes in and verifies that we're providing all of the different pieces of programming that we are required to as a public health department. We had that. Boy, that was about a month ago, or maybe a little bit more than that. We touched base today with the state. They said the state health officer is reviewing their recommendations, and we're gonna be getting some feedback and outcomes back within, I would imagine, hopefully by the end of the year, but, so. I might be Pollyanna on that, but yeah. And then I just did wanna share that, so Chris Howell, she's the public health manager right now, and then Nanishka Ruiz is the health officer, and they are working tremendously well together and taking care of all of our responsibilities with the extent of help that Tricia and I can give too. So we're trying to be supportive there, but they're doing a fabulous job. And then the last thing is just that I don't know, and Becky couldn't be here, I guess, so, but I was gonna ask her, just as far as scheduling for the combined board meetings. I'm not exactly sure how that, maybe that's Dick and Bridget talking together and seeing, you just tell us when you wanna meet and we'll be here, is basically what I wanted to say.
Yeah,
So-
unless Bridget's heard something, I haven't heard anything.
The only concern, and I think Jay and Rebecca and I'm not sure who else was in that conversation, but it's imperative that our medical director, who is Dr. Breidenbach, she is not going to be able to meet at 4 o'clock pretty much ever. So we need that entity on the board, for sure. So I think as we work through this, maybe we can have meetings for human service, more human service focused at 4, and then as we get closer to that 5:30 hours-ish, that then it becomes more health, Board of Health related. And hopefully we can meld that, and if Dr. Breidenbach cannot join us, then maybe she can join us towards the end of that meeting. I'm sure she will try, but I know in the past that's been very difficult. That's why our meetings have always started at 5:30 recently, but previous to that, it was 6 o'clock. So, and I think for most people to begin a meeting at 6 o'clock is a little more difficult. So we'll try to work with that and work around that and try to set, at least from the beginning, some sort of timetable and then see how that works out.
Yeah, the only thing I would worry about is when we need to have staff present at the meeting.
Right, so
You
that
know,
we have a
human
quorum,
services
because
staff.
she would be part of our quorum.
Well, I mean, human services staff, when they need to report, to have them stick around here till 6 o'clock. I mean, that's an issue for time, pay, comp
But our
time.
Board of Health staff was here at for
Right,
6
right.
o'clock meeting, so I think we could work around that. My goal is to get the board here first, and then the necessary staff, and then the trickle staff.
Right, but I don't want to
So we
start
have
out by
to-
separating them when we're trying to join the group.
Right, but
So that-
we will not have Dr. Breidenbach
Right,
at 4
So then we
o'clock in
just
the
meet
afternoon.
at 6 o'clock, or 5 o'clock, or whatever.
I don't know, I think if we're just flexible on both ends and see what way it works better.
I mean, you and I have a 6:30 meeting once a month.
Oh, yeah, I
At
mean, I
Western
don't,
Dairyland, and that whole staff, they
I
have to
don't
be
think
there.
it matters
Yeah.
what time it starts, but we won't have the luxury of having Dr. Breidenbach with us until later.
Well,
Oh,
I
she
think-
can't be here at 5 o'clock?
No,
5:30?
she cannot be here at 4. The earliest she agreed to was 5:30.
Okay, so we just meet
And
at
so-
5:30. I mean, that's what
Well,
I think.
I don't think I think that I would leave it up to the department head to work through the logistics of it.
Right.
I think we
Yeah.
meet when we have to meet, when it works,
Right.
works for everybody concerned, yeah. I don't think, let Jay worry about this.
You would,
Yeah,
Well, I'm gonna ask Becky what
Yeah.
she's thinking too. so.
yeah.
Your next meeting here, that constitutes what we have right now, or is that gonna change between now and January?
As I've heard, the January meeting is gonna be the same as it stands today. The both boards will be, standalone. And then I think what she said is February would be the first time that the boards would be combined.
Yeah, there's some things to work through in the meantime
Right.
to make it work out. There'll have to be a board rule change for one thing, in reference to the committee makeup and so forth, and that'll
yeah, I
be,
think that's on our
it-
on our agenda for December, maybe, our next meeting.
is that for Monday? Is
Yeah,
that on
and I
that
think
agenda?
Corp Council's working on
Yeah.
that and making sure the resolutions are,
Meeting this one.
Pardon?
What's the date of the county? board
Next
meeting?
Monday?
Next Monday.
Next Monday?
Yeah.
I never got a calendar this.
You're not gonna get one unless
Neither
you
did
ask
I.
for one.
I didn't get a calendar
If you
either.
want one,
it was handed out at our last
No.
board meeting with the paperwork.
No, I don't think so.
I found mine.
I didn't get one.
Well, I think I talked to Paul's staff that handles that, and if you want one, you let them know.
Oh, they don't send them out anymore.
Pardon?
They could put it in our packets that
Well,
we have on
I
our
made the
computer, and I
point,
could
but
print.
she said there are people who want paper, so that anyway. They
If I
cut
can't
away.
print it off at home, we can't use our computer, our phone printers.
Yeah, I haven't hooked into mine. I don't use my printer.
Apparently.
Yeah.
That's what I asked. I don't,
Yeah.
what do I know?
Well, and at the healthcare center, we had a annual audit. You remember that, Bridget? And how many pages was that? And did you copy it at home?
She sent it to me Lori sent it to me electronically.
Right, but if you wanted a copy of it, you had to copy it yourself, and I said, no way. This is not our responsibility to copy this 40, 50
Yeah, I
pages.
don't copy anything, I just look at it on my computer.
Right. And it's either, if you want a copy, you need to ask
It's
for
just
it.
something that you're gonna shred someday. All
Absolutely.
left in your computer here. You have to get with the program.
All I'm saying is flexibility, Jeannie.
I agree with you, Dick, I like it in front of me.
Yeah.
Well, you have it on your laptop.
I ain't gonna argue. I like it in black and white, front of me paper.
It's a waste. Total waste. Energy and ink and paper and work time for somebody to print it off.
Do you realize that if
You
you,
realize we're on TV having this argument, so.
yeah, do you realize that we spent all this time on arguing, we could pay for a lot of that paper? But
I just hate having all this paper.
anyway, anything else on your
Nope,
report?
that was it.
Okay, so we have completed the agenda for the evening, it looks like.
Dick,
Next meeting.
Dick, I just have one comment. When Jay was discussing the Board of Health or the Health Department, and the staff and how well they're working, I have really heard some really good comments about the healthcare staff up there feeling like they have more of a home. So thank you to Jay and all his staff for kind of wrapping their arms around those people. So they've really had a tough time in the last couple of years, so I think it's a good,
It's good to know.
good thing. Yeah.
Are you all gonna be together in the same area eventually?
I don't-
That I don't know,
Not- I
but
don't think so.
we did have a, yeah, doubtful, because we've got so many and the logistics just aren't there, but we did
Right.
have our first combined all-staff meeting on, it was the Thursday before Thanksgiving, and it was pretty cool.
That's cool, good.
Yeah, we all squeezed into the Trempealeau room, so.
Wow, that's a pretty good sized room.
It is, but there's a lot of us there, so, yeah.
Yeah, there's a lot of,
Yeah,
Chris is such a wonderful person.
Oh, they're all so good.
Can you make her stay forever?
I think she likes retirement.
I think, Bridget, your comment about location, the location for the various offices, it was, we approved that property.
yeah, and there's a couple different logistics for the health department. They need hoods for chemicals or whatever they're doing with their environmental stuff. So they see patients, so their offices, they would need 1 or 2 exam rooms. So their layout as a department would not be the same as what human services would be. But I think they'll be close enough that they'll be able to meld with each other and contact one another for referrals and anything else that might be
Yeah,
needed.
well, they're not gonna be any further away than other segments of your department.
Right,
I mean,
right.
you've got the
Yeah, they're
whole
just
first
upstairs
floor.
from us. Mhm.
Right, right. You've got
Yeah.
a, what should I say? You have an elevator, a fast elevator right out the door
yeah.
there.
And we are talking as a leadership team too, including Chris, about how do we get better connected, how do we have better communication and that kind of thing too, so.
You just yell up the stairs.
We do go up there and talk to folks quite a bit, so.
It's gonna be good. It's a good thing. Thank you for stepping up.
You're welcome, yeah, thank you.
And you're always smiling and happy, so I like that.
I'm trying.
There's a lot to cry about, so,
We stand adjourned until January
January
13. Same place, same time.